MedSLP Inside Look. What does a MedSLP do? Would you raise an eyebrow if someone told you a speech pathologist can help with brain surgery? Or that they should understand urinary tract infections? I know I didn't when I first started out as an SLP. Our field is so broad, we can do way more than people realize. Let's dive a little deeper into what's within the scope of medical speech-language pathology and what a day in the life of a Med SLP might look like. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. MedSLPs aren't limited to one medical setting or one treatment domain. We could find ourselves working in hospitals, outpatient settings, rehab settings, skilled nursing facilities, private practice, or a specialty clinic, like a voice clinic, home health, and a variety of other settings. It's a blessing and a curse, really. The good news is that your options are almost endless, and it can keep your career growth really interesting. But this also means that we have a lot of learning to do, and it's common for SLPs to feel really unprepared right out of grad school. According to ASHA, almost 40% of SLPs are employed in healthcare settings, including 16% in non-residential healthcare facilities, 13% in hospitals, and 10% in residential healthcare facilities. Nearly 20% of SLPs work in private practice, which allows you the autonomy to see these patients on your own terms without the corporate overhead. Many SLPs that work in community-based settings might see patients through home health, outpatient, or private practices. These settings are usually much more predictable and flexible in terms of scheduling, and you're able to have more autonomy in your treatment plan. I, for one, worked for about a year for a few home health companies, and I loved it. I was at a point in my life where I needed a change and a new challenge, and I was also building up my mobile fees business. I also loved my time working with these patients because there isn't a more functional setting than actually seeing the patients in their house. I loved having really sick patients, even ones on vents and trachs, but in their homes. It's very humbling and challenging, and I worked very closely with the nurses and respiratory therapists to help these patients. Medical SLPs also serve patients across the entire lifespan, from premature birth in the NICU to end-of-life hospice care. Counseling is a really important role in many of these cases, whether it's to help a patient and a loved one adjust to a new normal after a stroke, or to support your patient through their head and neck cancer treatment as they prepare for a life-altering surgery. Some of the more surprising places you could find a medical SLP is in the operating room or the burn unit. A neurosurgical team might team up with the SLP department during an awake craniotomy and brain mapping procedure, which is the coolest thing ever, where the neurosurgeon temporarily disrupts different parts of the brain to see what's impacted, like speech or language, to make sure those areas are protected during surgery. The SLP would test the patient's speech and language throughout this procedure and notify the neurosurgeon when a disruption occurs. It's pretty neat, right? Now, if you're wondering what a typical day looks like for a medical SLP, you will get hundreds of different answers, since it all really depends on the setting, the acuity of the patients, and the job description of the SLP. Residential healthcare facilities may include hospitals, skilled nursing facilities, or group homes. In these settings, it may depend if you're working in acute care, where you may see the patients for only a few days or weeks. Then your days will more than likely be triaged by severity of the patient and how soon they need to be discharged to their next level of care. You may see them for dysphagia diagnostics and a few follow-up visits, or even a few sessions of therapy to establish a form of communication with an AAC device or communication board, or a few sessions of speech therapy before they're discharged. If you work in skilled nursing or a different long-term residential setting, your day will still be very fast-paced, but you'll be able to spend 2 to 3 months or longer with these patients and really get to know their families and carry out a really lengthy treatment plan. Your day will typically start with deciding who to see first and in what order, depending on other appointments that the patients may have or when they can be scheduled for swallow studies. It's also important to factor in when patients work best. Some work best first thing in the morning, some prefer afternoon or evenings, and sometimes it's just whenever the heck you can get them. So a good day might be seeing 6 to 8 patients, but it's certainly not uncommon to have to see north of 20 patients in a day. Is that ideal? Is that perfect? Absolutely not. But of course it does happen. Do you want to work as part of a fast-paced team in the ICU? Or do you want to be more independent and form longer-term relationships with your patients in a skilled nursing facility? It's also important to consider private practice, where you'll be able to create your own terms to see patients. The bottom line is that there are so many different settings and so many different opportunities to work in this field under a myriad of different constraints. I personally loved working in the skilled nursing setting because I felt like I could really get to know the patient, their family, their interests, and really see progress over the long term. I had so much fulfillment in seeing a patient come in completely bedridden with a PEG tube from a brainstem stroke, and 3 months later, leave the facility eating, drinking, and walking. It makes it all worth it. There are so many times that we would take our patients out to lunch before they left the facility. Like, how exciting is that? I then discovered an even more nuanced passion of just providing swallow studies for patients in the nursing homes. And I owned a mobile fees company for 7 years that saw thousands of patients over 100 different nursing facilities. I've also done home health and PRN'd at a small community hospital. Now, once my personal life changed, I decided to focus on education and consultation aspect of our field. But I still feel like the work I do has a direct impact on patient care. What I want to reiterate here is that there really are so many different ways to see patients and have career fulfillment in this field. It just might depend on you getting a little creative and asking for exactly what you need. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like or subscribe button, leave a comment, and turn on the notification bell. Medical SLPs do anything from dysphagia, aphasia, voice disorders, cognitive communication, and motor speech disorders, or working with pediatrics with feeding and swallowing concerns in the schools. I worked in a SNF, a skilled nursing facility, for 6 years before realizing my passion lied in dysphagia, not just dysphagia, but dysphagia diagnostics specifically. And that's when I decided to start a mobile fees business, so I became really specialized in that area. And that's all that I worked with. So there's pros and cons to being a generalist, where you see every patient that walks in the door at that facility, versus being a specialist that you only focus on one thing. So think of doctors. We need both worlds, right? We need both family medicine doctors and pediatricians. We also need the specialists such as gastroenterology or neurology. There's no right or wrong way to specialize or not. It's just up to you what you prefer, and to be competent in either a wide area or a deep area. Many of these areas are also going to depend on the setting you work in, or if you desire a position with a certain patient population. If you want to work in an ENT office, you will most likely treat voice and dysphagia, primarily with some motor speech disorders mixed in. If you're in a skilled nursing facility, you will work with all areas as well, but primarily dysphagia, cognitive communication, and motor speech disorders. If you're in acute care, you will probably do a little bit of everything as well, but a large portion of that is dysphagia. If you're in an outpatient or private practice setting, you may see every population, or you may see a very specific subset. The beauty is that you can choose your own setting and patient population and how you feel most effective in helping patients. It truly comes down to you deciding what you would like to specialize in. Do you want to help patients regain their speech and learn to talk again, or use an AAC device? Do you want to help patients improve their voice, if they're a performer, if they're sounding hoarse or breathy? Do you want to focus on language, cognitive communication? Do you want to help patients learn to swallow again? Some SLPs only complete therapy, some only complete diagnostics, some do a combination of both, and others work as a consultative role or in administration. Others work alongside physicians and assist with diagnostics and perform treatments to rehabilitate the patient's voice, swallowing, or cognitive communication. The sky really, truly is the limit. I've got a bunch of free tools for MedSLPs at medslpcollective.com/enroll. Actually, we'll just stick that link down below in the description, but head over there to get your hands on those free goodies now. And at the Med SLP Collective, we have SLPs that work in a myriad of different settings. So if you're curious about learning more about any of those, head over there and get to know some.